assessing thoracic range of motion, I typically will have the patient cross her arms. And I'm going to have you try to bring your shoulders down towards your hips, curling as much as you can. Sometimes patients will need guidance to try to get as much flexion through the thoracic spine. You're looking here, you can find a lot of information about where available movement is or is not. And then again, you can apply pressure. And then you can have her come slightly out of that motion. And now don't let me push you down further. Good. Okay, and come on back up. Extension is slightly more difficult in the thoracic spine. I'll have you keep your arms crossed for me. And I'll sometimes apply a cue here and say, see if you can arch your back over my hand. And so you can get an idea here with where her available motion is, where she's moving and where she's not moving. And come on back up. Again, I don't like to apply much resistance or overpressure into extension. Let's have you rotate again. I will typically look at thoracic range of motion from the back, but you can gain a lot of information left to right from the front as well, so you may want to do both. Have the patient cross her arms again, and go ahead and twist as far one direction as you can. And here, when looking at the spine, you can actually see where there might be a stuck vertebral body or where the movement might not be as smooth. And then we can apply overpressure. You can decide if you want to come through the shoulder if they don't have any pre-existing shoulder conditions, or you can come directly through the spine. I'm going to give you a little overpressure and then come back off slightly. Now don't let me twist you further. Good, and the same to the left. We're going to compare the amount of motion that's available left to right, and then I'm going to give her overpressure, and then I'll come back out, and don't let me twist you further. Good, for contractile tissues. When we're looking at side bending, again in that same position with the arms crossed, you're going to have the patient try to bring her shoulder down towards your hip. They may need a little bit of guiding with this one. And again, you're looking for a smooth curve along the spine. You can stabilize at the opposite hip, give a little bit of overpressure, and then have her come slightly out of it. Now don't let me push you down. Good. And we'll do the same thing on the other side. Active range of motion first, then passive, we'll have some overpressure, and I'll have her come up slightly, and don't let me push you down, testing the contractile tissues.